Hello, I'm Dr. Avolio at Innovative Pain and Performance, and I'm just going to go over kind of what lower back disc complaints can look like. This past month of June, I've had a lot of disc complaints, lower back pain with radicular symptoms going either side, either going down the right leg or going down the left leg. And what this means for patients going forward. So what is a disc bulge, disc herniation? In essence, it is when there's a compressive load, either from an accident or over time, where there's compression in the front side of the vertebrae. So to orientate us, this is the back part of the spine. These are the little bumps that people will see if you have your shirt off. You can see the little bumps on the back. This is the spinous process. This is the actual disc, the body of the spinal column, whether it's your neck, cervical, thoracic, lumbar. So in this instance, most of the time, you're looking at disc bulges or disc herniations or disc complaints in the neck and the lower back, because what people feel is some kind of symptom down the arm or down the leg. Radiculopathy, sciatica, these are kind of general terms for that. So forward flexion is the enemy, as I call it, and that forward flexion over time creates this compression and then moves the inner, they call it jelly, it's this inner substance inside the disc that gets pushed out the back and then now is protruding outward, and then will affect the nerve. It can affect the nerve directly by actually compressing it, or indirectly creating a kind of inflammatory response that's irritating the nerve. And you can have a variety of symptoms of numbness, tingling, and weakness into the leg, or if it's in a neck complaint, down into the arm. So I've been seeing quite a few of these issues, this past month. So the other part of this is not only the disc and the spine itself, but how this connects into our pelvis. And then the biggest thing that I see is how people sit. So they'll sit in a flexed position. So that puts all this weight to the front, and then that is what creates the bulge out the back. Okay? So to counter that, we want to think elongate and come upward and stack the vertebrae. So that is where it's most efficient. So forward, too hot, too far an extension, too cold, we want to be just right, okay? And another important part of this is using pillows or things to kind of help support us while we're recovering. And at the clinic, I demonstrate, or we work on things that to help improve the spacing of the disc to allow greater relief, greater increase in not only mobility, in movement, function. I say that a lot of function of the joint, but then also trying to expand and improve the spacing so there's less compressive load. All right. Biggest thing that I can say as far as for people long-term, short-term, long-term recovery, long-term in particular, is having a good solid core. And you have to look at it as a cylinder, because all the muscles are on the outside of your core, and you have all your internal organs on the inside. And so you're reliant on this cylinder, kind of like a can, to support yourself. So if you have a good solid can, this is empty, solid can, you compress, it can withstand a lot of pressure. You have a compromised can, like this one, where it's kinked, I can compress much more easily, and it reduces and loses shape, and it cannot withstand much force. So the huge part of core stability is doing it correctly. That's not crunches, that's not sit-ups. Yes, it's planks to some degrees, but there's a variety of different planks, a variety of different ways to improve core stability that doesn't involve planks. You know, the biggest complaint I get from people with planks is it's boring. Well, I can definitely make it a lot more challenging with the saw or the stir the pot or other standing exercises. But the biggest thing is just learn and practice contracting, squeezing the core, squeezing the glutes, squeezing the lats, and then doing whatever activity that you need to do. That is the best really way in making it consistent and making a new pattern is the biggest help and the biggest challenge as far as keeping someone better long-term wise. So that is the injury of the month is the disc, and if you want to know more, please let me know and we'll discuss it. Have a great day.